Welcome to Yinz podcast. I'm your host Envy. Thank you for joining us today. Today we are launching a special series featuring a renowned clinical psychology professional who has over 16 years of experience in autism spectrum evaluations, cognitive development and developmental delays in children and adolescents aged 2 to 18. Whether you are a parent, educator or someone interested in child psychology, you won't want to miss this episode. Our guest today is Dr. Ginger Martin, a licensed clinical psychologist with over 15 years of experience in autism evaluation, in child psychology, and family support. She is the founder of Mindful Behavioral Health, where she specializes in helping families navigate the complexities of developmental disorders. Dr. Martin, thank you for joining us today. Let us start by addressing a question so many parents ask. Is my child just shy or is it something more? What are some of the early signs of autism that parents should be aware of?
Some of the early signs that a parent may look for in terms of autism spectrum disorder can be tricky to spot, but I always encourage parents to really trust that they know their child. But some of the things that we're looking for, especially in early childhood, would be a language delay. So if we have a child who is not developing language or meeting their developmental milestones with language development, that would be something that we want to kind of keep an eye on. And the second piece would be if language is emerging, but it's not functional. So if children are repeating words or they know their letters and numbers, but they're not using words for function in terms of making their wants and needs known, that would be something that would be an indicator. Another sign would be social delay. So could present itself as lack of eye contact or just lack of interest in social engagement, whether with parent or caregiver or other children. And then lastly, we would want to be looking for any unusual or atypical behavior patterns. So it could be sensory behaviors or repetitive or unusual play.
That's very good information, especially for the parents. Also, there is a lot of misinformation about autism. What is one myth that you would love to debunk right away?
That everybody presents the same way, or we may have sort of a stereotypical example in our mind of what an individual with autism might look like. And oftentimes that can be a very severe presentation. And it's good to remember that autism is truly a spectrum. And so individuals on the spectrum are going to present themselves very, very differently and are going to have various strengths and weaknesses. When we're looking at autism, there's 3 specific areas of criteria that have to be met. And it's all around a social base, so all around social functioning. So it's important to just have more information and understand how the diagnosis can be mild, it can be nuanced, especially if we're looking at older individuals, adolescents, or even adults.
You have worked with various age groups from 2 to 18. Are there different signs that emerge at different ages? How can parents know when it's time to seek help?
Sure. So when we're looking at younger children, oftentimes the presentation can be a little bit more significant or severe. So oftentimes in early childhood, parents will have a concern if their child has a significant language delay. Maybe they're not, developing language, or if their symptoms are more pronounced. So language delay, developmental delays, social delays in terms of things like eye contact or interaction, responsiveness, and then atypical behaviors. And oftentimes those will be some things that will draw a parent's attention to something that feels off or feels a little bit different in terms of their child's behavior or development. So oftentimes the calls for early childhood, autism evaluations at 18 months or 2 years or 3 years old, we're going to be seeing a little bit more significant symptoms in those 3 categories. Not always the case. Sometimes there's just, a concern with developmental delay and a few behaviors that parents are aware of and we want to investigate further. But as children get older, if we're looking at school age or adolescence, oftentimes the symptoms look a little bit different. So if we haven't really had many concerns until a child gets to, say, late elementary school, middle school, or even high school, that's an indicator that the symptoms might be a little bit more mild, but also that the symptoms are erring more on the side of a higher functioning autism or what used to be called Asperger's diagnosis or Asperger's syndrome. And that presentation indicates that the child may have had some typical language development up until, later childhood or adolescence, but that the social delay is becoming more pronounced as they get older. And so it may be things like difficulty forming social relationships, difficulty understanding friendship rules and how to maintain a friendship. Conversation skills can become a little bit difficult as well, how to maintain a conversation, maybe versus just talking about a topic that they're very interested in, sort of more one-sided, intense interests. So the presentation at an older state in development is going to just look a little bit different, just based on how the symptoms are presenting themselves.
Glad you mentioned this. Our next question is actually on that ground. What should parents do if their doctor dismisses their concerns, but they still feel something is off with their kids?
So oftentimes, yeah, if you're talking with your pediatrician, which is often, the first place that you'll go to talk about, you go for your, whether it's yearly or monthly checkups with your child, and they may often do some developmental testing. It's great to bring those concerns to the pediatrician. They often have a relationship with your child. They know them pretty well. And so most pediatricians are very interested in early intervention and being proactive as well. And so they may do some early screening and get your child connected with, say, early intervention services or outpatient speech or physical therapy or occupational therapy. But if you don't feel like the pediatrician is responding to your concerns, you can always ask for a referral to a specialist or seek that out. Whether it's just sort of going to some of the providers in the area or some of the agencies in the area that provide consultation and this kind of diagnostic evaluation.
That wraps up episode 1 of our series with Dr. Ginger Martin. We hope this episode helped you better understand the early signs of autism and ADHD. In the next episode, we'll explore the key differences between autism and ADHD and discuss what happens when a child is diagnosed with both. So be sure to join us next time for episode 2, where we will dive deeper into these two conditions.